I mean, for me, I usually forget this part, but now that I put it in the first slide, it's hard for me to forget. So if you have an issue with this being recorded, please let me know. Otherwise, welcome. We're happy to see you all here in September. And I will pass it over to our MC for the morning, Pete.
Thank you, Kayla. Yes, welcome everyone to our monthly MOTS webinar. And this month we are putting the focus on EDI. And as you guys probably know, one month we focus a little more on EDI and the other month more on the client entry part of our system. But this month is a little more on EDI, so you'll probably hear a little more from Jody, who is our EDI specialist. So, okay, go ahead, Kayla, and show us the agenda that we have for today, because it's quite busy from what I've heard, and it's quite a few things on there. So, as you can see, the introductions will be pretty quick. Why we do this, a little update. Justin will be talking about some anomaly reports, and I will talk to you about the pause update, administrative pause update. Then in combination with that, the reporting cadence, because that kind of comes with the pause update. Then Kayla will talk to you about the new roads go live date. And Jody will talk about EDI error messages. And she has 5 slides, so you better prepare for that one. Does that mean everybody have a lot of errors? No, it's just that she wants to reiterate how many different ways and things there are to look into. A little intro to MOTS that Kayla does every um, second Wednesday of the month. Switching from CE to EDI, you probably have heard that, but for those of you who haven't, it's always a nice refresher that Jody does that. Then we have questions and answers, and we'll show a little bit about our contact information that might be helpful to you to get to connect with us. So, okay, go ahead to slide number 2, Kayla. There we are, Kayla, Cecilia, Pete, Mary, Jody, Justin, and Anna. This is the team, and we all try to help as much as we can, each in our different capacity that we have within our organization. There's some strange voices coming and going. Is that me, or is it somebody else who forgot to mute? Okay, so yes, Kayla and Jody are the um, Rhodes product owners. So they're kind of like the ones who are in charge of making sure that everything that we have in MOTS also will be in Rhodes. So, and Mary and Cecilia, of course, our support. Justin, the report specialist, and same as Anna. And a lot of the tasks that Justin has been doing are being transferred to Anna, and then Justin is also uh, helping us out a lot in the behavior health data warehouse. Okay, and the next one is about why we do this. Well, I hinted at it a little bit already, to give you information on any changes and or enhancements. And currently the mod system is not changing at all, because we all know this is set and we're moving on to a new system. So, but once in a rare while, there is a federal change or a legislative bill that comes through that we have to make some changes here and there. Recently, we added fentanyl to one of the substance uses um, drug codes that we have in our system, because it wasn't there, and some um, it was kind of emerging as a drug with a lot of people. So we made that little change. It's a tiny change, but this is a perfect platform to keep you informed about that. We always love to discuss data issues. If there are issues, if things are going in a certain direction and we're seeing things that are not right, then we'd love to use this platform to talk to you about them. Any feedback you have, that's the nice thing about this Teams platform. It works a lot more interactive than the old ones that we had with the Zoom and the other one that we had before that. So ideas for future webinar topics are always welcome. If you are struggling with certain parts of the system or certain parts of the data that are not really clear, or anything that you would like to have us explain a little more and answer any of the questions that you might have. So that's what we're hoping to do today. And we have a full hour, and we hopefully have plenty of time. And the next one is some news update, if I remember correctly. Yep. The roads Resilience Outcomes Analysis and Data Submission System, ROADS. It's a good name. Resilience Outcomes Analysis and Data Submission. The development is currently in cycle 3, that is in progress. We do it in different cycles that are a certain amount of weeks. We call them sprints, and they have different names. The go live has been postponed because it was supposedly this December, but Kayla will talk to you more about the details and more information about that. Also, the reporting administrative pause has come to an end. The COVID pandemic has officially been ended a little while ago, and the administrative pause that we had is also ending, and I'll get more into details about that in a little bit. And also our MOTS support, we have a new email address. They used to be .state.or.us. It's changed a little while ago, so you might have the new ones already in there, but we always like to remind you that it is now the odhsoha.oregon.gov for MOTS support and for roads. So just wanted to let everybody know. And then the microphone goes to Justin, and he's going to talk about anomaly reports. Go ahead, Justin.
Thanks, Pete. Good morning, everybody. I understand there's a lot of text on the screen. I will go ahead and summarize that for those of you who may be doing more listening than watching of this webinar. This information also should appear in an upcoming MOTS Messenger newsletter. But as many of you know, every month we send out a series of anomaly reports. In fact, September's reports went out just yesterday, about 600 to 700 of them in total. You can blame me for that if you want. I built them. These are situations where the MOTS data looks like it might be wrong, but we can't tell for sure. There's some easy examples on your screen. Maybe we've got a little bit of feedback. Give me just a moment to address that. All right, that sounds better to me. So a couple of examples on your screen. Maybe we've got an 8-year-old client with a marital status of divorced. Is the marital status wrong, or did someone enter the wrong date of birth or the wrong admission date? We don't know. Or maybe we've got a client with test in one of the name fields. Is that actually their name? Because we've seen that. Or is a testing client actually submitted as a real one, which shouldn't happen? Stuff like that. We're bringing up the subject again, partly because as I was reviewing these reports recently, I noted a client with a last name at birth that was something like refused to answer or refused to provide, something along those lines. And that client has been showing up in these reports since they were initially developed several years ago. You're probably tired of seeing these. We are too. You can make your facility's anomaly reports smaller. You may even be able to make them disappear. So if you receive the report and you look at the list and you find an inaccurate entry, please fix it in your system and submit a status update. MOTS will pick up the change, assuming the data gets through without errors, and the client will disappear from future anomaly reports. If it's something you can't change, such as the last name at birth or the date of birth, send us a correction request so we can edit it for you. You can do that with our official change request form, or you can just return the anomaly lists with notes about what should be changed. And if the data really was entered correctly, even though it looks weird, let us know. We can hide those false positives from future anomaly reports. And then, if enough of the anomalies are resolved, and if enough of the false positives are hidden, then the anomaly reports will not be generated for your facility because MOTS will not detect any odd-looking data unless something new shows up. And just to finish up, I also want to mention that there are some facility staff members out there who respond to the anomaly reports every month, which effectively keeps their list to a minimum, sometimes responding in a matter of minutes, which is much faster than we expect, but we thank you for the responses either way. That's it for me, unless there are questions.
I am not seeing anything pop up yet, so but they might come. Thanks, Justin. And the next one is the administrative pause update. As I mentioned earlier, that during the pandemic, we had our requirements a little scaled back. We told everyone that the 90 days required update was no longer required, and we just wanted an admission and a discharge, and that was it. The status at admission and the status at discharge. There's been a lot of talking back and forth, and it has been decided by the powers at be that on October 1st, so that's coming up pretty soon, the pause on the MOTS reporting will end. So it will require the providers to resume the standard reporting, the ones that you have been doing before the pandemic kind of started. So, and I would like to go directly to the next one because many of you might wonder, like, well, what is the standard reporting then? And we have that on the next slide, and it's about the reporting cadence. One of the standard rules that we've had since the beginning of time, I think I should say the beginning of reporting, is that any new clients admitted to any treatment programs must be submitted to MOTS within 7 days. Try to get that information to us. We really like to stay up to date with what's happening in the treatment world. Crisis and involuntary service events, those are the one-time events, also must be submitted to MOTS within 7 days. And I know it's tricky sometimes, especially with crisis, because you don't always have all the information, but try to do the best you can. And sometimes not all the fields are required, and some of the fields have the option of other or don't know yet or non-applicable or something like that. So, but please get them in there. So. The non-Medicaid services must be submitted within 30 days after the month in which the service was rendered, which means if you are providing services to an individual in August, we recommend everybody to get a review in September of all the services that you've done in August, and then you just submit them once in September. And then that will kind of keep you up to date, keeps us up to date. And for the few that might be here that are using our online client entry tool, there are specific change parts of the system, certain buttons that help you make that a lot easier, because there's a lot of duplication in services for a lot of individuals. I know a group session or any certain sessions or certain services are repeated on like several times a week, and then a lot of times in the month. So it's easy to kind of get them all together, make the overview, get the system to run, and they're done, they're passed, and submit them to us. So what is coming back is the status updates at least every 90 days. And I know that a lot of you using your own EHR system have a much better response and do it once a week or once a month or something like that. And they are doing a great job. And please keep doing that. Don't try to make any changes to look to get it set up in at least every 90 days. If it's working great, then please keep doing that. And we like that actually a lot better if you can do it once a week, because it also helps you prevent a lot of errors, and all those errors Jody will talk about a little bit later. But if you make sure that you get your updates on a regular basis, then if you would do it every 90 days and you would accidentally put a close before an update in between, then the close is processed and you have an update later on in the file for some reason, and then it will reject that and you get an error because it says no, you can't update one because you recently closed this one. So things like that will be very easily prevented if you set up something within your system and your organization to do it on a like weekly, monthly, or bi-weekly cadence, and that will help a lot and will make a lot of people's lives a lot easier, because if you get less errors, smaller lists, it's easier to process through. The end of the treatment episode, finally, should be reported within 30 days. That's always been a rule. We always give everybody a little time to sort out the details, where the individual is going, how the status was, when the individual completed the treatment, or sometimes they leave treatment, or they disappear, or they get kicked out. And then it's usually a little harder to get all the information in there, but try to get there within 30 days. We don't set a clock or a deadline or something and start penalties or any of that silly stuff. But yes, we really like to see everything, the end of a treatment episode, within 30 days. I saw a bunch of things pop up. Did they have to do with the cadence, or were they questions about something else?
It looks like there was one question from Thomas about the new roads data dictionary, but I can handle that in the next slide, Pete.
You'll talk about that. Go ahead.
Okay. Let's move from this slide to our roads go live date rescheduled. Hello, everyone. This is Kayla speaking. As some of you might have heard, we have decided to delay deployment of the road system. It was December of this year, and we've pushed it out to April of 2024. The decision was really in order to capitalize on this new change and make sure that we can get the most data elements in the system when at go live. So we are able, or we're working now with our contractor to include data elements regarding stabilization services and Measure 110 services. And we really felt that this was going to be our best chance to do it is to get it all done at once versus having different releases for that information. As far as dates for things, and I know I've received a lot of emails, and I totally understand everyone's concern about when you're going to get more information. We have picked some dates yesterday, actually. We nailed down some dates that we'll be getting to providers next week. It'll also be in the next MOTS Messenger. I'll make sure that it is mentioned in our webinars. So these dates are not going to be hiding anywhere. I want to make sure that folks have the opportunity to engage with the roads team, to see the screens that we've built and how we've managed to build the system thus far. We're really excited because we think folks are going to like it. As far as the data dictionary, that is a document that we're still working on because we're still adding data elements for things like stabilization services, Measure 110, and mobile crisis. We're still refining that data dictionary, but as soon as we have that will be released to folks. And Jody, you might be able to speak more to the EDI piece of this for EDI specs.
Yeah. So we have been working we've got the documents actually in draft form. And so we our team and the contractor are going through those with a fine-tooth comb to make sure that we did get everything captured. All the business rules that may be added for especially stabilization and Measure 110. Additionally, mobile crisis will also be included in this, and Real D. So we have a few things as well that will be in that data dictionary. So like she said, next week we should have a date published, but we are hoping it will be here in the within the next, we're hoping somewhere in October to have them ready. And we do realize, I was hesitant to say that because we've missed the target once, and we don't want to do that again. Although I think there will be a huge value to do a one-time inclusion versus trying to do it twice in two different projects. So with this push, it's the same as we were talking before. Legacy MOTS will be accepted upon go live with the system. Roads version 2 is what we're calling the new roads data elements and setup is just going to be a build upon what we already have. So we will be working actively with the EHRs and their providers that use their systems once we get the documents out to start having some collaborative sessions so we can do some Q&A and we can kind of figure out where you all are at with your project. So we have had this a little bit of a push out, but we'll get real engaged once we get those documents out. So thanks, Kayla. I will pause there.
Thanks, Jody. I figured I should give you the microphone since this is an EDI specific session. I figured folks would want to know that.
Well, yeah, thank you. I just was a little reluctant on the date, but that because we've missed the one, and I want to be realistic with what we put out next week with all of you. So
And it looks like we have a couple of questions coming in, Jody, and
okay,
I hope you recognize them because I'm not sure what a couple of them are asking for.
yeah.
I'll take the first one. What does an update look like in the system? It means that if you make any changes within your EHR, that they are picked up by your export and created into the file. So a lot of the data is probably the same, but if an individual gets a new job or maybe gets his kids back or is doing much better on the drug problems that they were having, and there's progress, they get a new living arrangement, or they get stable housing, all that information that the changes you make in your system, hopefully they get processed into the export into the file and then imported into our system, and then we can see the same progress in our system. A non-Medicaid service is it's kind of like a snippet of the service that you do not submit as a claim to Medicaid. If there are services, and there are several charts to check what a non-Medicaid services actually is, and we have our EDI document where it gives you the specifics of submitting a non-Medicaid services file, because we have the status file and the services files. And I hope that answers, was it
Yeah.
Chris question?
Yeah, I believe so.
Yeah.
And I can take, once you get there, Paulina, any lanes.
There is also a question about revenue codes, I assume, or CPT codes. I'm not really sure if they are going to be in there. And that is more a question for Kayla and Jody. Real D and Soji is a part that we are working on, and parts of it will be in there, and which part exactly and which part not, you'll probably find that out sooner than later when we have more details about that. So
yeah, the one thing I can say about that, Pete, is
go
that
ahead.
we are working off the Office of Equity and Inclusion's public facing document that went out June of 2023. So what's being put together in the roads data dictionary and EDI specifications will include Real D and SOGI. As far as mapping the demographics in OTS, that might be something we could take as an offline topic, Thomas, that you all and us could connect on. And we'd be happy to talk about that. And if anything of that is becomes valuable or seems valuable to the larger audience, then we would share that out with everybody. I'm gonna move on. Can I go on to Paulina and Elaine's?
Go for it.
Okay. So Paulina, first and foremost, we owe you a return email, and I do have that prepped, and we'll be sending it out. So it should address a lot of the questions that you had sent to us, I want to say late last week. So what deployment in April of 2024 means is that roads will be live, and the files, the providers that all of you are submitting, either through your own software connection to our server, or if your system's doing it automatically, like some of them do, that process is going to continue. Nothing is going to change. So come April 2024, we're going to have a couple day pause or so over a weekend to get all the data migrated into the new system, because we're bringing all historical data in. Everything that you've submitted into MOTS is going to be available. So once we hit, let's just say hypothetically, that Monday morning, roads will now be picking up your files that you or your system submits from your SFTP directories that you already have. So you're going to continue using your SFTP directories. You're going to continue with MOTS legacy version 1 files if your EHRs or your internal teams are not quite ready to submit roads version 2. We know typically there's a 6 to 12 month buildup period or dev time. So we understand that everybody may not be ready to go on April of 2024. So we've built in for that. You are expected in April to report the existing MOTS legacy files that you were sending to MOTS. There will be a sunset date for MOTS legacy version 1, but that will be determined based on collaboration with the providers and with their EHRs and with their internal teams, so that we can get a realistic understanding of when that date would be reasonable to shoot for. Okay, and then for Elaine McCord, hopefully I said that right. The mobile crisis reporting is going to be in roads. So we are adding different data segments to our EDI file specs for mobile crisis, regular crisis like we normally have, then mobile crisis, and then mobile stabilization services. So those will be coming out in the documents. And part of why, we're building this and we're trying to get more of this inclusion is to get the redundant reporting to multiple locations or one-offs kind of out of the mix as much as we can. So, you're still probably gonna have a few things, but those there, Elaine, that you mentioned will be included. Okay. I think I'm good. We have any other questions?
No, I think you covered it.
All right.
Yeah.
Way to go, Jody.
Thank you. Yeah, thanks.
All right. Well, I am done with that slide, so I think it is time for the Jody Kramer show about
boy.
error messages.
Yay.
Yeah, we will make this fairly painless. I know that a lot of folks and organizations have had shifts in staff and in kind of who's doing what, or have new people. So we wanted to go over this. EDI error messages are the returned information the following day that either you or your system submitted to MOTS. And if it was automatically done, like I know a couple of them are, then it's going to return this information. And usually it's presented somewhere within your EHR if it's being done automatically for you. These error messages are going to tell you, out of all the submissions you sent in your file, how many were good. It'll just tell you, yep, 90 out of 100 passed, and there'll be the 10 that didn't. It's going to return you some information. So there's a lot of things that can cause an error message. Some things are like required fields. You need to fill out the required fields. Some of the EHRs I know have built these into the requirements. So like it can't be submitted unless those are populated. And if you've got questions, after this webinar, feel free to reach out to myself and our team, and we can kind of help you navigate part of this because it is a little bit of an information. So required fields are super important. They got to be filled out. If you submit something without it, you're going to get it returned and say these fields are required. Situational fields are kind of a trickier one, where they are fields that aren't really required, but if you pick something else, like you say the client is going to be paid for by OHP/Medicaid. Well, now all of a sudden their prime number, their OHP Medicaid client number, now that's required. So if it wasn't included the first time, that's going to cause an error. There's other things, there's some examples here. I kind of hit the prime number one. Total dewey arrest field is important because there's some logic built around the 4 arrest fields. And so, it kind of has to make sense. Arrest within the last 30 days and dewey arrest within the last 30 days. And then total arrests, like they have to make sense. You can't say that I had 35 dewey arrests in the last 30 days, but my total arrest is 10, right? Because that wouldn't mathematically add up. So those are some of the things that will trigger error messages. So if you could go to the next slide, Kayla, or somebody. Another thing too that some of the organizations look at are, how much was successful versus unsuccessful. What are your error rates? If your error rates continue to be, way over, if they're like 50% or something, maybe we should talk about how things are working for you, and maybe it's just a process that some of your staff maybe just need some help. You might have new staff that just aren't as familiar with the MOTS piece. We know everybody is super stretched. And we're willing to kind of help out there, get them to go to the Welcome to MOTS or do a one-off for all of you. So yeah, that's important. And again, 10% seems to be the acceptable standard. We do have some folks, I want to say, that are, out of 1,000, submissions, you've got like 10 errors. So, all of you that are you are all, a lot of you are really doing a great job. So, but there are consequences, for inaccurate reporting. You could have to, even do a recertification if our, site teams come out and visit and they're looking at your MOTS reporting and it's not quite aligning with their expectation. There's just a lot of things that happen if you aren't kind of addressing the errors. There's also an important piece that if you do get an error on like a mental health crisis, or you get an error on an involuntary service, as Pete mentioned, those are like a one-time reporting event. It's important that if you did get an error, that you make sure that when you correct that error, that your system is able to recapture that and send it again. Because we don't stage anything waiting for you to fix it. If it isn't 100%, you get it returned and then you have to resubmit it to us. Okay, next slide, Kayla. Oh, so we do have the EDI file specifications guide for MOTS. And in the back of that guide, we do have some of the common errors that you might see for your files. So this is a great document. It's out on our website. If you need the link, we can get it posted or sent out to you. But this is really valuable. There's a lot of different reasons why your file itself might have a problem or the individual information you sent on your client. Okay, next slide, Kayla. Oh, look, Kayla's got it in the chat for you. Awesome. So again, just want to reiterate, the mental health crisis will need to be resubmitted. So if you get an error, make sure that you get that corrected, or your staff gets it corrected, because you might not be able to do it. You might be just not at that level where you can put that information in. But just make sure that your system has the ability to resubmit these, because it's just really important. And you know what? And if you're concerned, like, well, maybe I already sent it, or I'm not sure, MOTS will only take it one time. So if you do get an error that's like mental health crisis already exists, or you can't use the same date or time, that just means that we got it the first or second go around. Should your system send it maybe more than once, which I know a few of them do send them like 3 times, just to make sure that you capture them all. Yeah, so it's really important, that, especially with everything that we do, but crisis events, and the mobile crisis, and that it just, if they're not successfully accepted by us, it's really hard to get a true picture of what's happening across the state, and also individually with the clients, and how their different treatments and modalities that you're doing, how that's having an effect on them. We want to be able to get a true representation. Next slide, Kayla. We're halfway through. Like, we're getting this painless. The non-Medicaid service is another one that you can get errors on. And you want to make sure that if you send a non-Medicaid service file, you look at the results, because those are important, whether they're in your system or looking at what we sent you. Any of those that didn't make it in, and the most common errors that we see with these are client ID doesn't exist. That means that we didn't receive the admission or the mental health crisis or the first reporting on the client that would have gave us all client's information. So like their date of birth, their client ID, all of their name, all that kind of stuff. So client ID just means we can't match the service record for them, because we don't have them in the system yet, because non-Medicaid services are a subset of data. It's a little smaller, like more of like a billing piece of the data that matches with the client that's already been reported to MOTS. So that's a common one. Second one that's common, probably more common, is even the last name at birth or the date of birth doesn't match. So as Justin was kind of mentioning, things that you can't change, which is last name at birth or date of birth in MOTS, right? If you get this error, what you got to do is you need to look at what you have sent in your, what you have in your file. So if you sent Smith and we have Jones, until one of those is fixed, so the two are in alignment, the same and spelt the same, case doesn't matter, but spelt the same is important. Until those are that way, your services are not going to be able to be accepted. So that's where we have that official MOTS data correction. Justin went over that. That's what you fill out, you send to us. If we need to change MOTS, maybe you see somebody changed it in your system and it really shouldn't have been, then you can just change it back to what it needs to be, and then they will be in alignment. But bottom line is the date of birth is either mismatched or last name at birth with what we have in MOTS, and that's how we got to fix them. Now, once we have them in alignment through your process and ours, then you're going to want to resubmit the non-Medicaid service, okay? And non-Medicaid services are kind of like the mental health crisis and involuntary services. MOTS will only take it once. So if for some reason, the only way you would be able to resubmit it is just to, rebatch all of those again and send them off. It's okay, because the ones that were accepted the first time are going to say that this transaction ID already exists. So it's going to give you some information that we won't take it more than one time. Yeah, I know this is a lot of information, but felt like a good place to present it. So let's see what the last slide is. Was that it?
Yeah, it looks like you get a little, you get one slide to take a breather. And then you're back at it in the next one. So I can take this one.
Okay.
I know Jody mentioned it, but we have begun, as of maybe 5 or 6 months ago, an Intro to MOTS webinar that we hold on the second Wednesday of every month. And this is really to design to onboard new MOTS providers or providers that have, maybe forgotten about MOTS for a while. Someone new at your agency is now responsible for MOTS reporting. It's really time so that folks can ask us questions and you can understand, or providers can understand, why we're collecting this data and what we use it for. Unfortunately, this September, next week, we won't be able to host it, but we will be back in October. So if you'd like to register for the Intro to MOTS webinar, I am putting the link in the chat right now. Sorry, it's hard to type and talk at the same time. Yes, so the next one will be October 11th, and we hope to see folks there. And Jody, I'll hand it back to you for one final slide here.
There were some questions in between though,
yeah.
so maybe we want to look at those first.
Oh, I did not even see that.
That's what I'm thinking.
There was one about the errors not being grouped together, about the rest fields. I know they are together in the segment, but does the error checking sometimes have a different sequence, Jody? I'm not 100% sure about that. No, they should be all together, right? Yeah, because it's all four fields are right behind each other.
They should be all together. Yeah. I mean, what would be Kayla, somebody said the links expired for the Teams thing, but if you could maybe the individual with that question, if you could give us just a little bit more information on that, we'd be happy to look into it. It might be where your system has them presented. Oh, okay, Nathan, awesome. You'll send an email. Perfect. Great.
And then a question about, what was the other one?
Well, I'll take
new technology. Yeah.
So yeah, I'll take Larry's. So good news is we're not going to be waiting 24 hours to get the results files back. So we're looking at maybe a 5-minute interval for once they're posted, that they are picked up. The system is being set to listen throughout the day and to be able to provide those in a timely manner. Additionally, there will be access through the roads portal, which is the provider portal, where the providers will have a little bit more interaction and information to actually see the files that processed, to look at the contents, to look at the results of said deal. And we're trying to look at some ways for that to also be able to drill down to the client. It would be in a read-only mode in the portal, so we can keep the EHRs in alignment with their data, but it will be multiple times throughout the day. So I'm hoping, Larry, it isn't rest. I don't know exactly what the official word is, what they're calling it, but it is on the Microsoft Dynamics platform, and we're using a lot of the different plugins and different tools. So there's many pieces in the mix making this all happen, but it will be much more quick. And then on the last one, combining dupe files. Do you know what that might be?
Not really sure. I wanted to go back to another
Okay,
question about
sorry.
billing and
Okay.
the question about HCPCS and CPT codes. We are reintroducing service elements. So maybe I'm not really 100% sure how that translates to CPT and HCPCS, but there is some form of a financial link is being built back into the system. How the details specifically are, I'm not sure. I don't know if Jody or Kayla know exactly how that will be working, but okay, so that won't solve the problem for the CPT. Maybe you can send us an email and let us know what problem you're trying to solve, because we never have done that. We've never done any revenue codes or anything in the system. We have had, and they were connected to county contracts usually, and they were linked to different types of services and stuff like that, but don't think we've had and ever put any of that information in there. So maybe we can take that offline and look into that with a little more detail. Jessica, I hope you can do that.
Well, and Jessica, we could set up a time to chat with you about that, because so yeah, let's I can send you an email with some of my availability, and we can see, and that your email would be great. I know you sent stuff in the past, so if you can pull that forward and send it again, or send us something new, that would be great. I was going to say there was a comment about PGNet is instant on the submissions, and PGNet has a different way of the files being uploaded. But PGNet also doesn't have quite the volume that the road system has with the amount of clients and transactions and stuff that we have. So hopefully this interval of, every 5 to however many minutes is definitely going to be a vast improvement, and it will still allow everybody's data to come through in the way that it should. So we're catching everything. But yeah, I appreciate the deal on the PGNet, because it is different. Okay, so
I think
switching.
the dupe clients has to do with
Oh.
merging clients. I think if I figured out the detail. When we report duplicate clients recorded on your form and let you know when we need them combined. So that has to do with merging clients. If they have the same person in there twice, and we figure out that it's actually one individual. If that can be a little quicker, because now it's sending in the spreadsheet with the information. We have to, it is currently still a manual process that we have to do with the help of our Office of Information Services. We have some tech support that need to help us with merging. It was a functionality that we've been asked for from the get-go of MOTS, and we never got. And currently it's still a manual process. I'm not sure how this is going to be dealt with in roads, but I'm pretty sure it is high on the wish list that it's going to be a lot easier than, and without the interference or the extra steps to go to our OIS team. Am I saying that right?
I believe so.
Good.
Sounded good.
No, I mean that it's going to be.
No, yeah,
We can
no,
take
we,
care of it. We don't need OAS to help us because it's going to be
yeah,
a functionality is going to be built into, and it might be just us seeing it and doing it, but then we can skip the step of sending an email and relying on the one tech support person that we have for us
yeah,
for our current mod system. So, and if
yeah,
that person is on vacation or out a couple of days, then it can take a little while. So, hopefully
yeah,
that will
yeah,
be a lot faster. So, yep,
that will be a like a super user admin function that we can do
right.
at a request. That'll be, yes, much hopefully faster. Um, okay, cool.
Cool.
I
That was it,
appreciate
I think.
everybody's, yeah, comments and interaction. That's what these are for, is to be able to answer all, try to answer all your questions or take them offline and figure out where we need to go from there. So switching, this is switching from CE to EDI, but this also really refers to switching from EHR to EHR. Sometimes you may be going to a new platform of yours, or you're getting a whole new system. So this is kind of what this speaks to. So the first thing we really want you to do is let us know that you're thinking of changing, even if it's just an upgrade of your existing system. We can talk about maybe what may or may not be impactful to your MOTS submissions. If you're looking at brand new systems, we've gotten feedback from others that, sometimes it's helpful when you're trying to figure out what works best for your organization, right? Because a lot of different systems tailor to a lot of different type of activities that you do. It's just to find out what's the process, how does it work, how does MOTS work in whatever you're looking at, from the time you see the client to the time the file gets to us. That'll help you to determine who and what our pieces are required, who's going to do which steps. There's never one way that works for everybody. There's just differences, but it's helpful when you're trying to look at MOTS, which will be roads, just to see what that complexity is or how that's going to work. Project timing is important. We'll go over what your timelines are and make sure we have staff that can assist with that. Process for switching the data submissions. We'll talk about that. And we've been doing it now about 10 years. So, and roads should be very similar. So we're definitely keeping what's been working and modifying what we needed to be improved. Your secure file transfer protocol setup is going to be the same. As you can see, we're even keeping it from MOTS to roads. So if you're going from system to system, you'll still use the same one. If you don't have one, there's a process to get you one. And we've got that all nailed down as well. So we'll get you set up. That's where your files actually come into us, so that at the state, so MOTS or roads will be able to process them. If you're getting a new system, maybe we need to talk about your client IDs. Are they going to be changing? If you're using the same facility, we can help you get those changed. Define your business processes. That's kind of on your teams, because that's kind of internal, but it's just an important piece we point out. We will test the EDI files out of your system. So even if you go with a system who has, 5 or 10 or however many providers using it, we test your files to make sure any customization or other things that might have been implemented to work best for you all, that it all passes through to what MOTS needs. So we'll do that. We're going to go live. That's always the exciting part once we've got everything ironed out. And then we're going to follow up. And part of the follow up is it's going to be, helping you out if you got questions once you're getting files going back and forth, those error messages we talked about, results files, those, we go over those things, maybe the workflow. And the other thing that we're going to do when we follow up is, if you did decide to use a new facility, right? Like you said, I think it's going to be cleaner to have my EHRA in the facility we were reporting in, and we want EHRB in a different facility. We can still tie those clients together because they're still in MOTS, right? So when we do that, which is totally fine, we want to make sure we come back around to EHRA and we address that facility and either have your old system close those down. That's the preference, so that we get all the information on the clients. So in that follow-up and actually through the process, we'll talk about, how do we shut down and inactivate the old facility? And when we inactivate it, the records are still there. Everything's still there. We can still see the clients. It just pulls it out of the reports that you get and other things like that because you're not really using it anymore and you don't need those. So some of you may get contacted. We are going through some of the ones over the pandemic that we still need to shore up. So if you get a contact from us, we will work with you and see what we can do to get that accomplished. Because if it's been a while, you might not be able to do it with your old system because it might not be there. So our teams will work with you to figure out our best strategy to assist you in getting those things done. Okay, Pete, I think that's probably enough of me. Unless we got any questions.
I thought I saw Nathan's hand go up and then but I think it went down again. So because I don't see the hand anymore. So I think I'm looking at the chat and I think we've answered the questions. If somebody's still not clear, we always just send us an email because we're getting pretty close to the end of the presentation that we had today. And wow, it went by pretty quickly. As Kayla mentioned, it is recorded and it will be posted on our MOTS website under the webinars and newsletters. And it's usually pretty quick. It used to take several days because we had to go through the help desk and needed help and blah, blah, blah. And now it's right there. So on that site, you also have past editions of the Messenger, the newsletters that we have, and all the future webinar dates that are coming up till the end of the year. I'm not sure if we've started next year yet, but we will be working on that. Our next client entry focused webinar will be on October 4th. That is the first Wednesday of October. And the signups are available on the website. Anything that popped up, I see a little red dot, so that means something. No, sorry, it went down. Oh, so that was sorry, I raised the hand. Yeah, okay. Or sorry, it went, nah. We'll see. Thank you all for joining us. If there are no more questions, we presented the contact information about the emails where you can send any questions or any issues that you might have. We have all our names here with all the oha.org and .gov, the MOTS website, and the MOTS support email. Whenever you have any questions or anything is not clear, there's the front line is Mary and Cecilia, but they can always ask us for any help for Justin, Anna, Kayla, Jody, myself, and we are always here to help. This is one of our big tasks that we do is the MOTS support, and we all work on that very hard. So hope you had a fun webinar and hope you have a wonderful rest of your day, and hopefully we'll see you again in October. Thank you all very much.